2008, he was the first one to have a condition with the tumor on his spine, and we were referred to the University of Iowa through our family doctor.
They did an MRI when he was an infant, and they found that he had this tumor and that it would need to be removed or he would be paralyzed from his waist down. Nate, after his surgery, he was, followed very closely, and then he had his second surgery when he was 4. Just to see him out playing and running around and riding a bike and being a kid is probably the best thing that I could ever hope for. I remember the first time he even went out to play baseball, it almost brought tears in my eyes to see him run around the bases. We were sent to Iowa City very early with Luke. I was only 11 weeks pregnant. We went through a lot of ultrasounds and many procedures until I was about 23 weeks, and Dr. Pevich diagnosed him with a coarctation of the aorta. And she said, "It's going to be fine, just come, we'll do a controlled birth in Iowa City." And we did that. Everything was very smooth, and he had surgery when he was 6 days old.
I met Mrs. Anderson in my fetal clinic. Her little boy was carrying a diagnosis of an abnormal aortic valve, or bicuspid aortic valve, and also the narrowing of the aorta known as coarctation of the aorta. So this prenatal diagnosis was key in allowing us to provide Lucas immediate and prompt cardiology care to give him the best outcome possible. Since then, he's done great. He's thriving, he's 10 years old, he's doing all the fun things that an elementary school child should be doing.
From the very beginning, it was scary because we were so early into the pregnancy, knowing that there was a problem. But when we met the doctors up there, several of them, including Dr. Pevich, they really assured us that this is going to be okay. We knew that we were in good hands. Especially after this last surgery, we've had so many comments about his energy level.
I saw a huge jump in his school improvement. His scores are going up after surgery, and after being in school all day, he got off the bus and came running off and said, "I can't believe how good I feel."
After everything they've been through, and to go up there and to go to the football game was just an experience in itself. That was fantastic. The boys went out with Chuck Long into the center of the field, and they announced it, and the whole place erupted, and that was it. It was beautiful. It was perfect.
What a pleasant experience for them to come up there and be rewarded like that and have everybody cheering for them. I mean, that was just awesome.
I want to thank the University of Iowa hospitals for everything, especially my boy's health.
The University of Iowa Children's Hospital is a place where you're not going to be treated like a number. You're going to receive care, you're going to receive the information you want, you're going to have your questions answered. It's the best place to be.